As you may recall, we were the first to tell you about Hillsborough County Fire Rescue drugs that were tampered with. Tonight, new details about some of the changes prompted by the problem and when they might be in place. In fact, it's been nearly 2 years since we first broke this story. Our most recent update revealed how vials with painkillers meant for patients were punctured and diluted. 8 on Your Side investigator Walt Buteau is back tonight with another update to show us what's being done to protect this drug supply.
Keith, this investigation covered a brief period, but more than 6 dozen punctured drug vials were found, and a paramedic resigned right away. Then the focus was, did any patients receive diluted drugs, and how could the department stop this from happening again? What started with a medic noticing a compromised vial in July of 2021 led to the discovery of punctured safety caps and slightly uneven levels of the liquid in 81 containers on 15 fire rescue vehicles. Testing by investigators revealed painkillers meant for patients were diluted. The documents 8 on Your Side obtained stated a paramedic recalled he attempted to use fentanyl on a patient, and it did not have the desired effect after using the entire bottle. Rescue Division Chief Todd Carnell tells us there's no record any patient received diluted narcotics, but it's possible that that individual, though, got a diluted drug.
It would be possible. I can't say that it wouldn't be possible.
15-year veteran paramedic Michael Ryer resigned after the investigation started. In August, the state attorney cited a lack of evidence in the decision against charging Ryer, who has not responded to multiple requests for comments.
I do understand why it's very hard without videotape to say this person did this act. And we don't videotape in the back of the ambulance for, HIPAA, to make sure patients' confidentiality is protected. Go here to unlock, turn it.
Carnell tells me after the problem was discovered, outdated drug cabinets in backup rescue units were replaced with these vaults. They were already on the frontline fleet and helped find the suspect.
Well, the new style of vault was what allowed us in less than probably 30 minutes after the 2 first units presented here with drugs that appeared tampered with, allowed us to drill into who we thought it was. We knew immediately.
Starting next week, high-tech drug dispensers like this one will go online in each battalion station. The machines have several checks and balances to restrict who has access.
The dispensing system will send emails to logistics, the battalion chief, me, and our internet technology people that machine was accessed. It puts another control on the narcotics.
Michael Ryer's paramedic license expired at the end of last year, but he is still a licensed nurse in the state of Florida.
And apparently did not impact his record in any way as a nurse or a paramedic. Right?
Yeah, you're right. We found out it did not. He has a clean record, both as a former licensed paramedic and a registered nurse, still has that license, with no discipline or public complaint on file with the state right now.
Well, hopefully these changes will make a difference going forward.
We'll see.
Thank you, Walt.
Okay,
Appreciate
Keith.
that. If you have something you'd like Walt to investigate, you can call the 8 on Your Side helpline, the telephone number 1-800-338-0808.